Again. Hand hygiene, enter the room. Hey, how you doing today? How do you know the patient? Okay. My name is Jared. I'll be your nurse today. We're doing a physical assessment.
Hello, Jared.
Okay, can I check your wristband? What's your name and date of birth?
Chloe Arditi, 8/1986.
Okay. Do you know where you're at?
In the hospital.
Do you know what month it is?
November.
Do you know who the president is?
Biden.
And you know what we're doing today?
The physical assessment.
We are. Okay. So a client is 4 times oriented. Do you have any allergies to anything?
I'm allergic to Bactrim.
Bactrim? And what does that do to you?
It makes me vomit.
Makes you vomit. Okay, I'll note that. Can I check your wristband to see if you have your allergy band on? Okay, thank you. And are you in any pain?
I'm not in any pain.
Okay, that's good to hear. Okay, we're gonna do a general inspection. Face is symmetrical. We're gonna note that. Okay. Airways seem to be open. No labored breathing. I'm gonna check perfusion. Skin is pink, dry, and intact. Client is oriented and coherent. Okay, we're gonna do your vital signs now. We're gonna go over those. 120/80 was your blood pressure. Your 99% on your O2 sat. And your pulse rate was 74, which is pretty good in the normal range. So no interventions needed for vital signs. We'll do it again when you come in for your visits just to see if there's any changes. Okay? All right, so we're going to no tubes and no equipment is going to be used. We're going to check for safety. We're going to scan for safety in the room. We're going to raise the bed here just to let you know that. Okay, the side rail close to me is going to be down, so I'm putting the rail down. And then we're going to raise the back rail to make sure it's safe for you. Okay, the next thing we're going to do is we're going to do a head and sensory assessment. Do you have a history of any vision problems?
No.
Okay. Do you have a history of any hearing problems?
No.
Any kind of throat issues, like difficulty swallowing?
No.
Okay, so we're gonna start with your head. So we're gonna start with symmetry. It's noted. We're gonna check for your expression. It's relaxed, and we're gonna go into your mouth here. So I'm gonna make you say ah. Mouth is moist, pink, intact. Let me see your teeth too. Teeth are intact. Okay, all there. All right. So now we're gonna do your eyes. So we're going to watch the pen here, all the way to your nose, follow, 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 thank you. Now I'm just going to watch the pen, where I'm going with the pen. Awesome. And now we're going to use a light now, okay? So it's going to be a little bright. I want you to stare at something on the wall, okay? And I'm going to start from the right, I'm going to come all the way in, you're going to get a little brightness there. Thank you. So we're going to start from the left here, come all the way in. Pupils are equal, rounded, reactive to light, and accommodated. They also measured around 2 millimeters on both sides, so they're equal. Okay. The next thing we're going to go to is we're going to evaluate the chest. Put this away. All right, we're going to check just regular breathing here. Symmetrical. Respirations here, looks good. Breathing's unlabored, doesn't seem like any respiratory distress. Now we're going to auscultate. Chest here. We're going to go to the Erb's point, which is between the 3rd and 4th intercostal. All right. Seems like a regular rate and rhythm. Let's check the S1 and S2. The lub and dub sound good. And no, it does not seem like any arrhythmias or abnormalities, which is good. Now we're going to check the lungs, the anterior lobes first. If you want to put your legs down, please. Thank you. Just breathe in and breathe out. breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Now we're going to check the lateral side, the lateral lobe. Breathe in, breathe out. Thank you. Breathe in, breathe out. Now we're going to check the posterior side. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. No adventitious sounds, no striders, no crackles, no wheezing. The lungs sound good. Okay, if you want to, just you can sit back again. Okay, and now do you have a history of any chest pain?
No.
Do you have a history of shortness of breath? A history of smoking? Just a history of any cardiovascular issues?
No.
Or any chronic diagnosis?
No.
Okay, good. Okay, we're also going to check for skin turgor. So I'm just going to pinch your skin here. All right, and let it come back. Skin is supple, no tenting, so we're good on that. All right, so we're going to go to the next thing here. We're going to go all the way to your abdomen, okay? So I want you to lay down. Thank you. Okay, so I'm going to ask you a few questions first about your medical history. When did you last void?
This morning around 8 a.m.
Okay, when was your last bowel movement?
Also at 8 a.m. this morning.
Okay, if you had any like nausea or vomiting?
No.
Okay, how's your diet?
I eat the Mediterranean diet 90% of the time.
Okay, okay. And how's your appetite?
I'd say normal.
Normal? Okay. I'm just gonna, if you wanna pull up here, yeah, right here, thank you. I'm just gonna check for some things here, check for no edema, no lesions, no wounds. Okay. Now I'm gonna auscultate, and I'm gonna look at all 4 quadrants here in the abdomen. Just breathe normally. Sorry. Just breathe normally. Normal active bowel sounds in all 4 quadrants. Okay. Here. Okay. All right, I'm just gonna check here one more time. I'm gonna palpate. All right. Is there any pain in any of these when I do this?
No.
Okay. No distensions. No tender, so it's non-tender, non-distended. There's no other issues. All right, if you want to sit up. Thank you. You can put your legs back down here if you want. Awesome. Okay. Now we're going to do your upper extremities. Do you have a history of like any numbness, any tingling, any weakness, any joint pain in your upper extremities?
No.
Okay, so I'm going to check your arms here, just real quick. All right. No pain there?
No.
No edema, no lesions, skin is dry, pink and intact. It's also warm, I'm checking that. The temperature of the arms look good. We're gonna do a little bit of range of motion now. So what I'm gonna get you to do is put your arms out, and then in front, down. Just kind of rotate them a little bit. Good job. And I just want you to wiggle your fingers. Looks good. Full range of motion in the upper extremities. Okay. Now I'm going to come all the way down to your hand here. Just want to check your fingernails. No clubbing. Okay. All right. Now I'm going to do capillary refill. Less than 3 seconds. 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 Capillary refill for all fingers are less than 3 seconds. Plus, it's a bilateral +2. Okay, now I'm going to check your radial pulse. Okay, thank you. Radial pulse is +2 bilaterally, and we're in a good range there. All right, the next thing we're gonna do is we're gonna do some strength things to strengthen opposing forces. So what we're gonna do is gonna squeeze my hand. Good job. One more time. Oh, yeah, strong. All right, you're gonna push. You're gonna push now. All right, you're gonna push. She's a 5 out of 5 with her strength of opposing forces. And now we're gonna work down to your lower extremities. So it's easier if you lay down while I'm doing this. Thank you. Now, do you have a history of any numbness,
No,
any tingling,
no,
any weakness,
no,
any joint pain?
no,
Okay, so I'm gonna check your legs first, all the way down from your ankles first to your feet. No edema, no lesions, no wounds, no cuts. Okay. All right. We're gonna do a little bit of range of motion stuff here. So what we're gonna do is you're gonna bring your knee to your chest. Knee to your chest. Good work. All right. And here. Thank you. All right. I'm gonna go there. Just kind of rotate your ankles in like a circle. Pretty good flexion there. Push down and up. Good plantar flexion and dorsiflexion. Now I'm gonna work down to your toes here. I'm gonna do a capillary refill on our toes. Less than 3 seconds. 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 Good job. All right. Less than 3 seconds. Less than 3 seconds. All right, now I'm gonna check your pedal pulses here. It's right on top of your ankle here. I'm doing both at the same time, bilaterally. We're a +2 bilateral on the pedal pulses. Okay. Now, so next what we're gonna do, if you wanna sit all the way up, please, we're gonna do strength of opposing forces like we did with the upper body. Okay. You're gonna push. Now kind of bend your knees back a little bit. Now push. One more time. And push. And now we're gonna bring your ankles towards you. One more time. Woo, very strong. Threw my pen out. Okay, so very good. You can actually lay on your stomach here. We're gonna assess the skin integrity on the posterior side. Okay, so I'm gonna check first. Okay, it doesn't seem like any edema or any kind of swelling or no lesions too. We're gonna check right here. It's called the ischial tuberosity. I'm gonna press it. It's not tender. You any pain right there?
no,
Okay, there's no pain. We're gonna check near the sacrum. And also any pain there?
no.
Good, there's no pain there. Okay, so everything seems to be good there. All right, we're gonna sit all the way back up. Okay, we're gonna do a safety measure first. We're gonna lower the bed because we're done with the assessment. We're gonna put both side rails up. Okay. And now we're also gonna establish a plan of care. We're not worried about any kind of rounds or medication. We did draw blood, so we'll get your blood results, blood test results when we get it. We'll let you know and bring you in and see if there's any issues. Any questions about anything today? I mean, this is the physical assessment, and we went head to toe, and you seem pretty healthy. Any questions?
No,
Okay, well, it's my pleasure, and I'll talk to you in another day.
thank you.
Okay.